Okay, hi everyone. So today we've teamed up with Havant and East Hants Mind Charity, who are the official charity partners of the Hampshire Football Association, to discuss mental health following on from this year's International Women's Day and tying it in with this week, which is Mental Health Awareness Week. The topic today, therefore, focuses on women and mental health. My name's Izzy Pearson. I'm the Business Development Lead for Hampshire FA, and I'll hand over to our two representatives to introduce themselves.
Hi everyone, my name's Hannah Humphreys and I'm the Women's Recreational Football Officer at Hampshire FA.
Hello, my name's Lorna Howes and my job role is Sports Club Ambassador and Community Fundraiser for Havant and East Hampshire Mind.
Perfect, so we'll crack on with the first question of today. So I'm going to start off with a quote. It's really important for women to stand up and be counted too. There's a big emphasis on men and male fans to speak about their mental health because men are typically more at risk of suicide. However, that doesn't mean that women can't stand up and say, actually, I've also struggled and this is where I'm at. I think it's really important for everyone to know women, men, children, everyone is counted. Everyone's got their voice and everyone can use it. So that's a quote taken from Newcastle United Women's FC captain Brooke, and it's featured on the club's website. I will provide references at the end. So question to you all, and specifically focusing on that last line, everyone has got their voice and everyone can use it. And we're talking about grassroots football specifically. How can they use it? And where can they go to be heard?
I think it's really important to note first that it's not an easy thing to do to open up and talk about how you feel, but it's something that is definitely really important, and it's something that can definitely help moving forward if you are willing to do that. In terms of making your voice heard, I think the most important thing you can do to start with is, if you're in a team and a club environment already within sport or within football, is ensuring that you've got teammates around you who you feel comfortable sharing that with and sharing your voice with, and getting that support gathered around you. And once you've got that, I think it'll be more comfortable for yourself moving forward, especially within that club environment. A lot of clubs, especially grassroots clubs, also have welfare officers who are there to support you if you do have additional concerns that you want to raise and you're looking for that additional support. So it's definitely beneficial to reach out to other members within the club structure and within your club setup as well, and gain that support. But yeah, it's not an easy thing to do, and it's a really brave thing to do. So but it's definitely something that will help your own kind of how you feel about that moving forwards, definitely.
Fantastic. I think, Hannah, you drew on a really important point there with saying it's not a very easy thing to do and it's a really brave thing to do. So what we want to try and do more of within grassroots football is to normalise those conversations around mental health. So actually you can go and be heard to your teammates, to your peers, to your coaches, to your welfare officer, to your safeguarding lead, because we want to normalise those conversations around mental health and reduce that stigma as much as possible, so that actually those support networks are within place within grassroots football, so they know about local services that people can go to and then find further support. Because like you say, it's such a brave step to make once they've then been heard within their teammate. Once we've normalised it, we've reduced that stigma, then knowing about the services, they can go on and find that support, hopefully within their local community. And I guess the other point here is that it's not just necessarily about being heard. If you can talk openly about mental health and have those really honest conversations within your club, actually you're going to potentially help someone else, maybe another teammate who might be going through exactly the same thing, at that point doesn't feel that they can talk about it. But by you talking about it, by being heard, they then will hopefully feel more comfortable. And again, it's just reducing that stigma and normalising it, just having those conversations around mental health. We all have mental health, so it's just so important that we do talk about it.
That's lovely. Thank you very much, both of you. So in England, around 1 in 5 women has a common mental health problem, such as anxiety, depression, and risk factors that are most likely to affect women could include any of the following. They've experienced physical and sexual abuse, which can have obviously long-term devastating impacts on one's own mental health. Things like sexual violence, which can cause obviously post-traumatic stress disorder. So question for you, Lorna, what are some of the signs would you say grassroots clubs and members within that club should look out for?
So it is quite difficult to pinpoint certain signs and symptoms for people experiencing mental ill health, because every condition is so different. Like we've just listed a few there, but there's so many different forms of mental ill health, and they all impact every individual differently, because we are obviously individuals as a person. My biggest, I guess, point or thing to look out for would be to look out for changes. So actually think about how well you know those people in your team, and if you see any changes at all. So it might be changes in their behaviour, it might be emotional changes, so they might become more upset than they would normally. It might be actually changes in their appearance, so it might be that they've lost a lot of weight recently, or maybe they're looking a little bit tired. So look out for those changes. It's really about noticing changes, and it can be changed to different extremes. So I just said, I think it might be that they've lost a lot of weight, but they could also be potentially gaining weight or something like that. So just looking out for those changes. So the better you know your team, your teammate, your coaches, all those people around you, the more likely you are to potentially notice some symptoms or signs that someone might be experiencing. The other point that I'd just like to make really quickly here as well is some people are really good at also just wearing a mask. So you wouldn't necessarily even see anything. They'll come in with their nice, happy, smiley face that they do every week. And it can be really difficult to actually notice anything's going on behind the scenes, because they've got that mask on that they're wearing week in, week out. So it's actually going back to our previous question and making sure that we're having those really meaningful conversations with people. We live such busy lives. We don't always necessarily, when we say, how are you, ask, how are you? We're just going, how are you? And then walking off in the other direction. So really actually taking the time to say, how are you this week? And just having that conversation with them. So those would kind of be my top tips and things to look out for when it comes to sort of signs and symptoms someone might be experiencing.
Brilliant, thank you very much. And obviously, Hannah, specifically within grassroots football, have you encountered any females who have shown any of those signs? And what other signs do you think would show there was perhaps a problem, obviously going by your experiences involved in the grassroots game?
Yeah, I think it's really important what Lorna said there about just changes in general and really understanding your players. So from, say, a coaching point of view, so I coach at a grassroots club, a women's club. And from a coaching point of view, we're always told it's really important to understand our players from a performance side of things. So if we understand how they play, we'll get the best out of them. But actually that relates so wider than just playing and performance. It is about understanding who they are, what they need, and when those changes occur, we're able to recognise them quickly and provide that support if that's what they need. For us on a ground level, it's just having those really little conversations like Lorna just said. If we notice that someone's acting a little bit differently, their behaviour's changed, or if it's visible that something's different, then we will have those conversations and just check in and make sure that those players are doing okay. At our club, we have 4 members of staff, and we are mentors to the players as well. So at the start of the season, each player gets to pick who their mentor is for that season, and that's based on who they feel comfortable talking to. So it's not on the ability of the coach. It's not based on anything to do with their playing position and the coach and how much they understand that. It's based on how comfortable they feel talking to a certain member of staff. So I look after 5 or 6 girls across the team as their mentor, and we talk about everything off the field. So what their work week looks like. Is it a bit stressful for them at the moment? If it is, when we do go into training, maybe we just take back the amount of information we're giving them and just kind of deload what we're putting on them that week. And even smaller things like if I know one of my players is on their period that week, and actually physically playing football is a lot for them and emotionally, then it may be the way we communicate them during the session is very, very different. It's less maybe direct or shouting across the pitch and giving instruction, and more one-to-one intervention. So as Lorna said, it's really important to understand our players and understand how they tick, and if there are things that are changing within their life and are slightly different, we're able to adapt to that. And also remembering that all of our players are human. They're all going through other things in their life aside from football and aside from sport. So one of our players this year lost her mum at the start of the season, and it was, you know, really recognisable to us that she was just not herself and she was not ready to be playing sport at that point. It wasn't an escape for her. It actually became something that she didn't enjoy, and it wasn't right for her to be involved. So we gave her time to, you know, go and have that leave, take the time away, be with your family, do what you need to do, and welcomed her with open arms when she was ready to come back in. And it's really important to recognise when people need your support and need you to be around them, and when they need their own space. And just knowing our players this year and putting time aside to do that has been so important. And that's something that all grassroots clubs can do, any age, any level, any ability. And it's definitely helped us create a really kind of open and honest environment, like Lorna was talking about, and players being able to speak openly about how they feel and what they're going through.
So important. So obviously we're leading on to then self-care. So sometimes people just don't want to be open, obviously, and reveal everything. Obviously, it's great that you have that contact with your players and as a team, Hannah. But like Lorna, you mentioned people would like to wear a mask, and you wouldn't be able to know any difference because they come in, they have the smiles on their face, and you think everything's sort of fine and dandy. So whether that be through fear, being judged, feeling just uncomfortable in the process. So what coping strategies or recommendations would you advise them to do, either at home or where they feel most comfortable, that could improve their mental health?
Yeah, I definitely think there's a number of ways on a personal level that I've done to help my own kind of mental health over the last year or so, which is definitely something I've struggled with over the last year, going from a playing capacity to a coaching capacity, and not realising how that would affect me, and not being as physically active as maybe I was. But it did make me realise how important physical activity is. And that just means, like, on my lunch break, especially when I'm working from home, I make sure I go out and go for a walk. Otherwise, it just really affects my whole day. So getting out of the house is really important, even if that's something as simple as going out for a walk around the block.
Yeah.
And that becoming part of my routine. Routine for me really helps. So knowing that I get up at a certain time, I'm making sure I'm going out for a walk, I'm going to the gym, whatever it may be, but routine really helps. And surrounding yourself with the right people. I definitely found that maybe a year or so ago I wasn't surrounding myself with people who, you know, cared about how I was feeling, or when I was open and honest, maybe the feedback I got from them wasn't what I was expecting. So making sure the people around you are the right ones, and that's definitely something I've got now, and I've noticed that that's made a big difference. So I think those three things are really important in terms of self-care for me, but it's different for everyone. So I'm sure there's a number of ways and things people can try to support that as well.
Thank you. That's very, very honest, actually, especially when you said about the people that you're, recognizing the environment having an impact. And yeah, thank you very much, Lorna.
Amazing. Yeah, no, Hannah, great examples of sort of self-care and ways to look after your own well-being. I tried to get a little bit creative here with my idea for sort of self-care and looking after your well-being, because we're talking about football, grassroots football, and a lot of people who will play football, their escapism a lot of the time is to go and be active, and you get to connect with your community around you. So I was kind of trying to flip it on its head and think about something where it was slightly different for someone to do potentially when actually they maybe are taking a bit of a step away from the sport. So for example, potentially, like you said, Hannah, in your last example, on the last question, where you could just say it wasn't quite right for that player to be playing at the moment, so they had to go away and they took that time away. What else can they do during that time in order to support their well-being? Because what they would normally be doing isn't there and isn't an option for them at that time. So I've gone with mindfulness. Now, when people generally think about mindfulness, they think about meditation, but there are so many different ways to be mindful. It might be, for example, like Hannah, on your lunchtime walk, you might not take any headphones, you might leave your phone at home and just take yourself outside and just lose yourself in your thought. It's really just about being present in that moment. So you can do active mindfulness. So it could be sort of doing yoga or going for a walk. It can even be things like mindful colouring. So just anything where you're going to absolutely lose yourself for 5-10 minutes at a time. And it's almost like You spend 10 minutes doing it, but it only feels like a minute. And that time just really refuels your tank. It puts your tools back in your toolbox and allows you to go into that rest and relaxation mode, which we all need a little bit more of in our lives. We're all so busy. We live busy lives. We're running from A to B, whether that's from work to football training, from football training to getting home to caring responsibilities. Whatever it is we're doing, mindfulness is a great way just to spend 5-10 minutes of your day, and it can be in so many different forms. Said a few, maybe like baking as well. People like to do a bit of mindful baking. People think I'm a little bit odd when I say this, but mindful eating as well on your lunch break. So actually taking the time to sit away from your phone on your lunch break and take that time to rest and repair, pop it on. Lots of different ways to be mindful, but actually to help with self-care. So that would be my top tip. I was trying to be a bit creative.
I love that, Lorna. I actually do have Gareth Moore's books on mindfulness. I quite like doing the various different activities, because for me, it's all about mental stimulation. I can't just sit there and look at a film, look at a series. I have to be doing something. I find it very, very difficult to just switch off and tune into something. So for me, I can have a series on in the background, but I can also be doing an activity in the mindfulness book. And for me, that just helps, because I'm in need of that sort of mental stimulation. So I suppose just before we finish then, do you have any lasting comments, tips, or other pieces of advice that you would like to share with our audience today?
I think it's just really important that people know that it is a brave thing to do, to come forward and speak about how they feel. But it's something that we're very fortunate that a lot of people, especially kind of professionals within the game, are coming forward and talking about more openly, which is really great to see. Especially within the women's game, for example, we've had a couple of names that have come forward and speak recently about mental health and about how important it is to make sure that you're checking in on yourself almost and where you're at. So it's something that is really coming to light, and hopefully it will make people feel more comfortable in, as Lorna said, just speaking really honestly and openly about how they feel, especially within their grassroots teams. And there's lots of support out there for clubs and teams to know how to provide further support for those people that do come forward and share how they're feeling and are able to direct them to where they need to be. So yeah, it's great that more people are talking about it.
Thank you, Hannah.
So yeah, I think my just final sort of thoughts on the whole thing is that I said it earlier, but everyone has mental health. Our mental health is going to be impacted by different things. So how we feel today isn't necessarily how we're going to be feeling next week. So equip yourself with the right tools in your toolbox to support your mental well-being, and also be aware of what services are available to you locally. Until I started my role in a local mind, I really didn't know what services were available. So it's definitely worth visiting your local mind's website to see what they can do to offer support as well.
Lovely. Thank you ever so much indeed for you both for joining me today. We will be posting obviously the references as well to some of the things mentioned on today's chat, and we'll also be sharing the links to the Minds website, and hopefully we'll have more people come forward to talk about their mental health. Thank you very much indeed for your time today.